Hi, my name's Jo. I'm a paramedicine student and needing to do a respiratory examination on you. What was your name?
My name's Michael.
Michael, and how old are you, Michael?
I'm 41.
41 years old. Okay, this examination involves exposing your chest and me observing it and then having a feel and inspecting it, listening and also tapping on your chest. Is that going to be okay?
Yes, it is.
Great. Okay, so we'll just start if we can take your top off and we'll start and then I'll observe your chest. Okay, so in observing the chest, patient appears comfortable at rest. There's no obvious signs of breathlessness or cyanosis at all. There's no accessory muscle use in the abdominal area. The chest rise and fall is very symmetrical. No audible wheezes or stridors that can be heard. No significant scarring or deformities that we can see at this stage. And looking around, there's no signs of inhalers, medications or home oxygen use at all. So first up, Michael, I'll just get you to just show me your hands if you can. Firstly, just going to have a feel of them. Hands appear warm, that's great, just relax them for me for a second. I'll just put some gloves on. Okay, so just again looking at your hands, if you can hold them up for me. Just looking to see there's no signs of cyanosis. Nail beds are good colour with good cap refill. There's no signs of tar staining. Just turn them upwards for me there, Michael. And good colour on the underside as well. I'll just get you to bring your two fingers forward for me and put your two nails together like that. And we'll just put them together. That's it. Just two nails together, that's the one. So we're looking for signs of nail clubbing. Wonderful, great, thanks for that. Relax your arms. I'm now going to get you to hold your arms out at vertical level and just keep them holding there. Ideally I'd hold them there for 30 seconds to see if there's any fine tremors indicating use of bronchodilators such as salbutamol and the indication of asthma. Great, now I'll get you to hold them like you're pushing a wall away. Good. And here we're looking for any coarse tremors with the indication of COPD or CO2 retention. And again, holding this for 30 seconds ideally. That's great, just relax your arms for me then. Okay, I'm just going to have a feel of your pulse here. Just relax your arms, relax everything. Good. So feeling a pulse for 15 seconds and also doing a respiratory rate. So respiratory rate currently sitting at 20 and a pulse rate of 74 at this stage. So I'm just going to have a look at your face there, Michael.
Yep.
At this stage there's good colour, there's no obvious flushing to the face, no cyanosis around your lips or anything like this. I'll just get you to pull down on your lower eyelids for me if you can. Good. No yellowing and signs of anemia, that's fine, thank you. Now just get you open your mouth nice and wide for me. Good, and lift your tongue up to the roof of your mouth. Good, so there's no cyanosis there showing any sort of signs of hypoxia, etc. from there. I'm going to have a look at your JVP next, so I'll just get you just to relax into the chair. I'm just going to get you to tilt your head slightly to the left, looking into the corner of the room. I'll just guide you there. That's it. So just looking if the JVP is elevated, and in this case it's not. Great, that's fine. So we're looking there, indication of a pneumothorax or hypertension. Okay, so from here I'm going to inspect your chest. So again, just relax into your chair, looking at it. I'll just get you to put your arms out for me. Good. So looking down both sides, no signs of any scars, surgeries, anything like that. No history yourself, Michael, of having any surgery in your chest cavity?
No.
Good. Any other surgery recently that you've had in this chest, head, neck area?
Just operation of a tumour roof of my neck.
Good, so that's the scar that we can see on your side there.
Yes.
Okay, and it's still a bit sore?
A little bit tender, yes.
Okay, so we'll just be careful with that one. Right, so I'm just going to inspect your windpipe. This involves just pressing a little bit onto your chest. It might be a little bit uncomfortable for you. Okay, so just feeling down there, there's no deviation, everything feels good. And you're looking at 4-finger crocosternal distance, which is normal for a patient. I'm now going to be feeling the apex of your heart, which is the 5th intercostal space. Okay. At the same time, I'm just going to feel for your carotid. Good. Good. Okay, so I'm now going to actually touch your chest and palpate your chest with my grip. I'm just going to put my hands across here. Big breath in for me. Good, and relax. Another one, breathe in, hold on. Just breathing in and out again for me. Good. And again. That's great. Again, no pain in your chest or anything at this stage?
No.
Good, I'm now just going to tap on your chest. Just normal breathing's fine. Put your elbow out towards the wall here, Alyssa. And on the other side. That's great, thank you. And now I'm just going to have a listen to your chest. Just nice and normal breathing for me. Might be a little bit cold, I'm sorry. Just pointing your elbow out to the wall again for me. And other side. That's great, thank you. So for the posterior chest aspect, percussion was symmetrical and resonant, and auscultation was symmetrical with no abnormal sounds such as wheezes or crackles. Now I'm just going to have a look at the back side of it, which is also going to involve me feeling your neck for your lymph nodes. I'm going to be very careful of this scar area on this side.
Yeah.
Okay. If I'm hurting you, just let me know. So just lean forward slightly for me. That's it. So feeling intraclavicular and supraclavicular. Just being careful of that area. I'm not going to touch that side there, up the cryope nodes. And in there. Not hurting you there?
No.
Good. Good. So I'm just going to get you to slightly turn around so we can have a look at the back here. And back, we're inspecting the back. Again, no obvious scarring or deformities to the chest. Just going to have a feel. Big breath in and out for me. Good. And again. Good. Great. So again, I'm just going to tap on that chest. And we'll just have another listen. Michael. You can relax back into the chair now. So also on the posterior aspect, like the anterior, the auscultation, everything is symmetrical with no added sounds, crackles, wheezes, or abnormalities. Percussion is resonant and also symmetrical. No coughing or anything recently, Michael, that you've been having?
No.
No breathing difficulties at all?
No.
Great. So if the person was asthmatic, we'd look at doing peak flow if they had one at home. Otherwise, this has produced a normal respiratory exam at this stage. Thank you very much for your assistance, Michael.
Thank you, you're welcome.
Okay, hi, my name's Jo, I'm a paramedicine student and needing to do a cardiology assessment on you today. What was your name?
Michael.
Michael, and how old are you, Michael?
41.
41 years young. Okay, that's fine. So for this assessment it involves taking your top off, and we'll be having a look at your chest. I'll have a bit of a feel of your chest as well, and then we're also going to listen to your heart sounds in your chest and your neck, etc. Is that going to be okay?
Yes, it is.
Okay, great. So I'll get you to take your top off now. Okay, just relax into the chair, nice and comfy. And I'm just going to observe you for a minute first of all. So observing the patient, he appears comfortable at rest. Normally I'd position you on a bed at a 45-degree angle to get best access and hear best for this assessment. There's no obvious surgical scarring that I can see to the chest. There's a small one to his neck, which he's described previously for previous tumours just recently, which is still a bit sore. Skin is well perfused, there's no medications nearby in the house, no oxygen supplies, etc. And doesn't appear short of breath at all. So Michael, just get a quick look at your hands first of all. Just hold them out for me, that's it. So just having a feel, they feel nice and warm and very symmetrical in their warmth. I'll just put some gloves on now. Okay, so I'll just get you to hold your hands up if you can there, Michael. So just looking at your hands, we're looking for any task staining. There's a good cap refill of less than 2 seconds, and just get you to flip them over for me. Good, again no tar staining, and back the other way. And no evidence of any splinter hemorrhaging, which is possible, bacterial endocarditis. I'm now going to take your pulses, Michael, which involves a few different techniques. So I'll just get you to relax into the chair first of all, just feeling this first part of 15 seconds. Okay, so we've got a pulse rate of 92 at the moment. Now I'm just going to feel both pulses at the same time. Just relax your hands again for me. Good, and there's no radial to radial delay. Just going to feel your brachial. Excuse me. Like a brachial artery. Have you got any shoulder pain at the moment, Michael?
No.
Cool, so I'm just going to feel your pulse and lift your arm up. And there's no evidence of collapsing pulse and sort of aortic regurgitation from that area. I'm now going to take your blood pressure there, Michael. Excuse me, can't get rid of this cough. Had your blood pressure taken before?
Yes.
Cool. It's a bit cold, sorry. Just relax your arm down. And hit your hand upwards. That's it. And better? You can hold that there for me. Nice and tight around the arm for a minute. Just stay nice and relaxed. a good blood pressure of 114 over 72. So 114 over 72. So we've got no significant narrow pulse pressure associated with aortic stenosis, and obviously if it was wide it would be more aortic regurgitation. Excuse me. So just going to be looking at your JVP now. So I'm just going to get you to tip your head slightly towards the left, that's it. And we'll just reposition slightly for you. Good, so just checking for any raise, which there isn't in the JVP, so that's fine, just relax for me. And just feeling for your carotid. And just like re-radio, it's a good, strong, regular pulse. You're going to feel for the other side there as well. And again, good and strong. And matching. So now just looking at your face, you've got nice, well-perfused skin colour, no flush of the cheeks or anything. Just get you to pull your eyes down for me there, Michael. Good, there's no yellowing in there indicating any anemia. And just looking, no, that's fine, just looking at your eyes now. There's no grey ring, yellow ring around the irises of it, indicating any possible hyperlipidemia or hypercholesterolemia. I can't say that word, sorry. Now just in your mouth, there's no cyanosis around your lips, just get your mouth nice and wide. And lift your tongue to the roof of your mouth. Good, no signs of cyanosis in there. Good dental hygiene, so again, bacterial endocarditis. Now I'm going to have a look at your chest. So just looking at the chest, there's no obvious signs of any previous CABG surgery, pacemaker surgery, bypass surgery, etc. on your chest. Just lift your arms up to the side there. And again, nothing down the side there. You haven't had any previous cardiac history at all, Michael?
No.
Involving surgery or anything like that?
No, I have not.
Good. Okay, so there's no deformities or anything that we can see. I'm just going to have a feel of your apex B. So going down to the 5th intercostal. Just feeling in there. Good, and to match that up. Good. So I'm now going to have a feel of your chest, which involves me pushing on there. I'm just going to be feeling for any heart murmurs and thrills. So just feeling again at the apex. And on the top. Good. Sorry, laying in your chair like that. Okay, so I'll just be listening to your chest now and listening to the different heart sounds that we can hear. It's a bit cold, I'm sorry. Just taking it, starting at the aorta. Now I'm going to be listening to your carotids up here. Ideally I'd be doing this with a valve, but not on this one. Good, so on auscultation there we've got normal first and second heart sounds. There's no abnormal sounds, murmurs, carotid bruise that we can hear. So I'm just going to listen for one other sound which involves you just sitting forward for me, Michael. So just leaning forward, just lean on your knees, that's it. Now as I do, listen, I'll get you to just take a deep breath in and just let it out as far as you can. That's good. Good. Okay, so now I'm going to have a listen to the back, just to the base of your lungs and things. So I'll just get you, if you can, for camera purposes, just to spin yourself right around here for me. Good. Just sit yourself up normal, that's fine. Normal breathing sounds there. Good. Now while we're there, I'm just going to push on the lower of your back there. Just checking for any sacral pitted edema. Which we don't, and you can spin yourself around there, Michael. Now I'm also going to have a look at your feet if that's alright. Again, just checking for any edema there. Just relax your legs. I'm just going to pull your socks down. And just relax your legs down. Just feeling around the ankle for any pitting edema. Good. And the other foot there as well, Michael. That's good. That's great. So to follow on from this, I would normally do a 12-lead ECG and get a full cardiac review of your heart from that, which we don't actually have in this instance. But on this examination, everything is appearing normal. There's no signs of heart failure with any pitted edema anywhere. Normal heart sounds on auscultation and no signs of pulmonary edema through auscultation of your lung sounds. So thank you very much, Michael. You can pop your top back on now.
Thank you.
Okay, hi, my name's Jo. I'm a paramedic student and I'm going to need to do a neurological assessment on you. Is that okay?
Yes.
Cool. What was your first name?
Michael.
Michael, and how old are you, Michael?
41.
41 years old. Perfect. So for the first part of this test, I'm going to break it into segments and we'll do the upper half of your body first. Then we'll do a bit of walking around and then lower body.
Yep.
The assessment involves me moving your limbs around a little bit and seeing your strength and power and things like that.
Yep.
Is that going to be okay?
Yes.
Cool. Have you got any pain anywhere on your body at the moment?
Just a little neck after an operation on my neck.
On your neck there? That's fine.
Yep.
We won't go anywhere near your neck for this one. So for the first half of the test, we will need to take your top off. So I'll get you to do that for me first of all. Just relax back into the chair. Get yourself comfortable. Are you comfortable there?
Yes,
Good.
I am.
Okay, so on observing first of all, there's no obvious scars or deformities to the chest that we can see apart from the minor one on the neck that he's already described to me. Slight scratch mark to the arm. Otherwise it's good posture, there's no tremors, no involuntary movements or twitching or anything at this stage. Looking around the place, there's no walking aids, wheelchairs, frame sticks. How do you normally get around, Michael?
Walk or drive.
On your own 2 feet?
Yes. I won't do
You
feet.
don't use crutches or a walking stick is what
No.
I'm meaning? Good.
Walk or drive.
Good. Okay. So for the first test, I'm just going to get you to say a few things for me after you repeat with me. I'll just be testing whether or not you're slurring your speech. Have you had any alcohol or anything today that might contribute to anything along this assessment?
No.
Good. Okay, so the first thing I want you to say is I just want you to say baby hippopotamus.
Baby hippopotamus.
Cool. And I'll get you to repeat it again.
Baby hippopotamus.
Good. And I'll just get you to say your address for me.
26A August Street, Stokes Valley.
August Street, Stokes Valley. That's great. Okay, now I'm going to get you to follow my finger with me. I'm just going to get you to keep your head still and just follow this finger with your eyes only. Good. That's good. No problems doing that at all, Michael?
No.
That's great. Okay, so for the next test, I'll get you to have your arms out straight for me. Just want you to hold them dead straight for me like that. That's fine. Now just keep them out straight and close your eyes. And just keep holding them there for me. Now I'm going to get you to turn your palms upwards for me, keeping your eyes closed. Turn your palms up and just hold the arms out straight for me. That's good. So here we're observing a pronated drift, and the person is not having any drift at all. A little bit of a wobble there. Just turn them back up the other way for me. Now I'm just going to lean on your arms, and I just want you to stop me from pushing them down. Good. And releasing. Good. Right, just relax your arms, and you can open your eyes again for me. Have you got any neurological history at all?
I suffer from neurofibromatosis type 2, or commonly referred to as NF type 2.
NF type 2? And that can affect you in what way?
Tumours, it causes pressure on all sorts of, affects the brain, learning difficulties. That's quite an array of things to actually list.
So it can alter your sensations and your coordination, etc.?
Yes.
Okay, so we'll take that into consideration when we do this then. So with that rebound test, there was negative anticerebellar disease because there was no real bounce back rebound over the level that we were currently at. So I'm just going to have a full range of movement with your arms and test your reflexes. So just let your arms go nice and loose for me, and just let me have all control of them. So just nice and floppy. Good. So just twisting around here, and your elbows. Good. Good, and the other side. Just let them nice and floppy. Good. Good. So no rigidity or cogwheeling there, Parkinson's disease. No increased tone from possible stroke. I'm just going to test your muscle strength in the different parts of your arms. So I'm just going to get you to put your shoulders outwards like that for me. That's good. Stop me from pushing down. Good. Stop me from pushing down. That's good. And now push. That's the one. Stop me from pushing up. Stop me from pushing up. That's good. Now I'm going to get this to do with your elbows. I'll just get you to put your elbows slightly outwards like this for me. So before we were testing C5, C6, now we're going to test C5, C6, C7. So stop me from pushing down on your elbows. Good. And now stop me from pushing them up. That's good. Relax your arms again. Now we're going to do similar with your wrists. So we're going to get you to put your arms out straight with clenched fists. Point your wrists up like you're going to push against a wall. This is testing C6, C7. Stop me from pushing them down. Good. And now go the other way. Stop me from pushing them back. That's great. Now while you've got your arms out like that, I'll get you to just flatten your palms again. So your fingers are out right. And we're going to keep your fingers closed. Stop me from pushing them down. This is testing C7. That's good. Okay, and just relax again. Normally here I'd do a tendon hammer and test your reflexes in your tendon. We'll be doing so by tapping them in here normally. We'll then be tapping here and then again tapping down here. But as we don't have a tendon hammer or a vibration tuning fork, we won't be doing those for this assessment. Okay, I'm now going to just test your sensations. How is your upper body sensation with your NF?
A few numb areas, but normally reasonably good.
Okay, so we'll see what we come across. So I'll get you to close your eyes for me. You can start feeling this?
Yep.
Good, so that's what I'm going to be doing down your arms. I just want you to tell me when you can feel it on your arms.
Yep. 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 Yes. Yep.
Just turn your hands up right under. That's it.
Yep. 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 Yep.
Good.
Yep.
Good. Now I'm going to do it with a sharp object. Can you feel that?
Yep.
Good. So it's just with a pin. It's not going to prick you or pierce the skin.
Yeah.
Just tell me when you can feel it.
Yep. 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 Yep.
Okay. So just a slight difference in there. Did it feel the same when I was pushing on it with each one? So each arm was the same when I was pushing with the pin, each arm was the same pushing with the cotton ball?
Yeah.
There was no altered, one was sharper than the other?
No.
Good. So just a slight difference when I was pushing the sharp on one of your arms, which is obviously a reflection of your NF. Otherwise you've got equal power, equal strength, good tone, good coordination, etc. for your upper limbs. Okay, so I'll get you to put your top back on and we'll move the chair and we will test your gait from here. Just get you to stand up for me there, Michael. Okay. Okay, so from here, Michael, I'll get you to come over to this corner of the couch here. That's great. Now I'm just going to get you to walk normally through to the other side. That's great, and stop. Now I'll get you to go heel, toe, heel, toe. Good. Now I'll get you to walk on your tippy toes. That's good. Now turn around and just walk on your heels for me. That's great. Okay, so if you'd just like to take a seat for me on that towel. Okay, so just like we did for the upper limbs, we'll be testing your lower limbs as well, testing your tone and your reflexes for this. Okay, so first of all, I'm just going to do a bit of a leg roll and just relax your legs for me. Just get you to move your arms. Just relax your legs slightly far apart. That's it. And I'm just going to be rolling them nice and loose. Good. And the other side. That's great. Now just get you to lift your shorts up slightly for me. That's it. Good. Now we're just going to lift from the knee, and I just want you to again keep your leg nice and floppy. So just under here. Good, and relax it. You're meant to keep your legs nice and relaxed. Relax your leg down. Just let me do the lifting, just relax it. Good. And then the other side. Good, so heels remained on the ground for that. I'm then going to test your hips and your knees and your ankles, similar to what we did with your upper arms. This will be testing all different levels for your hips, etc. So, just push up on my hand with your hip. Good. And again here. That's good. Now push your legs inward. Good. And pushing it outward. That's good. And inward. And outward. Good. Now your knees, push your knee up. That's good. And push it down. And pushing it up. And pushing it down. That's good. And your ankle, roll it outwards. And rolling it inwards. Good. And inwards. And outwards. Good. Now push your foot down to the floor, down towards my hand. That's it. And the other one. Good. Now pulling upwards towards your head. And the same for this one. That's good. Okay, so again we'll do some sensation tests on this one as well. We don't have a tendon hammer and we don't have the vibration stick again, so we can't test those in this level. However, for that we would normally be testing on your thigh, on your knee, and then on your ankle. So now we'll just do the cotton test again, so just close your eyes for me. Again, something like this. Just get you to tell me when you can feel it.
Yep. 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 Yep.
And this one here we'll be testing will be sharp.
Yep. 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 Yep.
Cool. Okay, so again we've had some differences in there of what we can feel and not feel, and you'd expect that for your NF
Yeah.
with your change. Is that because of previous surgeries it's affected the nerves?
No, it's a deterioration of the condition.
Okay, but that's all normal for you, it's what you'd expect.
Yeah.
Okay, so now we're just going to do the plantar reflex. This is involving running a blunt object up your foot. It might be a little bit ticklish. Have you got ticklish feet, Michael?
Used to.
Okay, so just relax your foot for me. Just relax it, let it go nice and floppy. Okay, so feet point upwards. So that's positive plantar test. Okay, so on completion of that, we've got some differences in sensation to Michael's legs and a little bit to his arms, more so his legs. We've got equal power and strength and tone in all his muscles and all limbs. His gait's a little bit unstable when going heel to toe and on his heels. Again, normal for his NF according to him. Otherwise, that's a neurological assessment completed. Thank you very much, Michael.
You're welcome.
Okay, Michael, so there's one more test that I did need you to do now that we're standing up again, and that's just the rhombic test. So I'll just get you to put your feet together on the floor, hands down by your side, close your eyes, and I'm just going to get you to stand there. I will be there to catch you if you sway too much. That's great, thank you. You can open your eyes. A little bit unstable towards the end.
Yes.
Thank you for that.